So how do you restore the blood flow to places where it needs to be? How do we do that?
So we have a number of different techniques that we can use to try to restore blood supply or blood flow to an artery. A lot of times you may be able to create a bypass, in other words, some kind of conduit or some kind of vein or what have you to get blood to an area. Or what we do most commonly is attempt to use some type of a balloon to take an artery that may be occluded or completely closed down or narrowed, and to open it up to try to get more blood supply.
And what are we looking at, Dr. Powell?
So what we're looking at is actually an interesting story. This was a patient of ours who came to see us a couple of months ago. And what we're seeing on our left is an image, it's an X-ray technique where we basically take the bone out and we're looking at the blood vessels going into the foot. And what we're seeing is what we're really not seeing actually is there's a very, very poor blood flow to the leg. And this is someone who came to us, interestingly, or not so interestingly, was offered an amputation as treatment. This is a woman who was having severe pain. She couldn't sleep through the night, which is another one of the hallmarks of critical limb ischemia. And she came for a second opinion. And what we did after this initial procedure, as we see on the right, if that plays, you can start to see our catheter and wire working down the front of the leg. And while it's going to take a lot longer than what we can show you, we're working our way through a completely blocked artery and working our way down into the foot. And on the next image, you can see the kind of blood flow that we could potentially restore. And there you have it. So on that initial image and pictures, we saw no blood flow going down the top of the foot. And now you see this big, robust blood vessel going to the foot. And what makes this so rewarding is seeing this person back in the office afterwards. This is a woman, again, who was faced with an amputation, thought she was gonna get an amputation, and she returns to the office and says, I can't believe this. I'm sleeping through the night, my foot feels great,
wow.
I'm walking again, and that's really kind of one of those great success stories that we love to see.